Hi everybody, Miss Rachel here. Are you looking for some tips on radiology? If so, you're in the right place. Today's video is brought to you by iCode Academy. Let's get started. Let's meet Max. Max came into his local clinic to see his physician. He's complaining of some pain in his shoulder and his chest, so his provider decided to order an x-ray. As you begin to code this chart for the patient, you see in your CPT book that it uses the term view. So what is the difference between a view and an image when we're discussing radiology coding? In order to understand the difference between what is a view and what is an image in regards to radiology coding, we need to understand our anatomy. Views are referring to what angle the x-ray or the image is being projected at the patient. So this is what matters to us as medical coders. How many views or how many angles are the images being taken from in regards to the radiology services? You could have one view, perhaps coming from the front end of the patient, but take multiple images or multiple pictures. So it doesn't matter to us as coders how many images or pictures are taken, but rather how many views are the images taken from. Here we can see a PA view, which is from the back to the front of the patient's chest. The AP view is going to be the complete opposite, moving from the front to the back. Our third common view is going to be a lateral or side view. Let's take a look at an oblique view. Here we can see that the x-ray is actually coming up from a lower angle. And lastly, we have an axial view. This is going to be a horizontal view, typically taken on a plane or an axle. And this is not common to see in x-rays, but more typical in MRIs and CTs. Now that we know the common various views in radiology, don't worry. You don't need to look at these in the individual medical record itself. The provider's responsibility is to document the number of views as well as list those views in the patient's medical record. Let's take a look at tip number 2, a complete versus a limited ultrasound. You can see here in our example of CPT code 76700 that we have a complete ultrasound of the abdomen, including real-time image documentation. So what does it mean if an ultrasound is complete? Per the description of the CPT code in your book, you can see that it consists of a real-time scan of the liver, the gallbladder, the common bile duct, the pancreas, spleen, kidneys, as well as the upper abdominal aorta and the inferior vena cava. Now, if these elements are not met or reflected within the documentation, we must default to a limited ultrasound. Now let's talk about diagnosis coding. Tip number 3 is do not code suspected conditions. Your primary diagnosis in relations to radiology is going to be the relative finding on the exam. If there are no positive findings, it is okay to go ahead and code the signs or symptoms as your primary diagnoses or to use a screening exam code. Your secondary diagnosis is going to be any additional significant findings. And we want to remember that we do not code probable, suspected, or any uncertain conditions. Tip number 4 is going to be don't forget about those modifiers. The intent of a modifier is to add additional descriptive terms to the CPT code selected, but not to change the CPT code. Common CPT modifiers used within radiology are going to include LT, RT, and modifier 50 to indicate the laterality or a bilateral procedure, modifier 59 to indicate a distinct procedural service, as well as modifiers 76 and 77. These two modifiers indicate a repeat procedure on the same day, either by the same physician or by another physician. All right, you ready for another tip? Tip number 5 is going to be keep an eye out for documentation regarding contrast. Based on our CPT coding guidelines for radiology, contrast is administered by various means. It could be an injection, it could be into the joint, into a vein or an artery. But we want to make sure that when we are coding for MRIs as well as CT exams, we are indicating they are either with contrast, without contrast, or with and without contrast. And we also want to make sure that we are not counting any oral or rectal administration as contrast. On behalf of all of us here at iCode Academy, I want to thank you for tuning in. Make sure you check out our video library for other helpful videos in your coding needs.